It's Suicide Prevention Week, but supporting mental health is a year-round commitment for us. We're working for you on this because you matter. All this week on the 4 and throughout the month, we will be sharing important resources that are available. One of them is the Here Now program, helping middle and high school students in nearly 24 school districts in San Diego County. Joining us now on the 4 is its bilingual program manager, Amy Chavez. Thank you for being here today.
Thanks for having me.
This is such incredibly important work and such a vulnerable part of our community, especially in the bilingual sense. They're non-English first language speakers. It's difficult to find resources. It's National Suicide Prevention Week. How important is a week like this to getting the message out, especially aiming at children who are out there in crisis?
So I think every day for us is Suicide Prevention Day week, but it's nice to have a week of the year to highlight, remind folks who to call, what to do. We know that there's a lot of people that are struggling with thoughts of not wanting to be here, hopelessness and helplessness, in some ways even more so since the pandemic, and so we want to make sure we're providing resources and support so that they don't have to walk that alone. There's so much myth around suicide, and a lot of times the lie of suicide when you're struggling is that it's hopeless, it's helpless, and no one can help. And those are all myths, because there is help and there are resources through our program with Here Now, which is a school-based suicide prevention and early intervention program in the schools. We're able to provide those classroom presentations talking about suicide, talking about mental health, demystifying how to ask for support, talking to friends, how to get them support, and then also following up with students that are in need of immediate check-ins.
You know, for parents, it's such a scary concept, such a scary topic. They think about their children, they just hope they'll always be safe. What can we tell them? What are some of the issues they can look out for? Things that manifest in children of these different ages that maybe they can keep an eye out for?
Well, I will say kids are pretty honest to a certain extent, right? They tell you how they're feeling, they'll tell you pretty upfront. When it comes to mental health, sometimes they get a little bit more scared. So it's important to pay attention to verbal and nonverbal cues that they're giving you. Those warning signs that might not be verbal, like pushing away from things they normally would enjoy. Their talk is a lot of hopeless and helpless. Their music is a lot of helpless and hopeless. They're not able to articulate maybe why they're in pain emotionally, but they are shying away from talking. Taking those moments to kind of highlight the concerns that you're seeing and saying, you know, I'm worried because it seems like you're not sleeping at all. Your eating has either, you know, increased or decreased to a level that's not healthy, and I'm just wanting to check in and see how you're doing. So we're not saying, like, right up front, like, are you feeling suicidal? You can be super upfront with that if you need to, but a lot of times it's staying curious and having those conversations, hopefully that are also not one-word answers. So asking, how are you doing, and what does that look like for you versus just like, are you good? Are you okay?
You use a tool called the SOS Program. Can you tell us what that's all about?
So SOS is a curriculum that is evidence-based that we use in our schools when we're providing the suicide prevention program. It has some great features, including videos, and like I mentioned, the curriculum itself is able to kind of streamline and talk about how to support yourself or a friend if they are going through a tough time. The main message being act, acknowledge the warning signs, care, show someone you care about yourself, and tell a trusted adult. We know students, high school, middle school students will hear a lot from each other before parents or school staff are looped in. And so we want to provide them with resources of how to help their friend and also to know their boundaries as friend, because we're not asking them to be each other's mini therapists. Right. We want them to be able to walk with their friends but not try to put on their emotional backpack.
What a great tool to try to give them to help walk them through this. So complicated. We only have about 30 seconds left. We're going to be talking about this all week with other providers, and we just thank you for what you're doing.
Thank you.
One thing you wanted to really touch on, make sure we have this incredible resource now, the 988 line.
Yes. So it's important that we use our resources that we do have. The more we use them, the better they will get, the more refined they will get. But 988 is a great resource for our entire nation. San Diego-wise, we have a lot of resources that 988 can connect a youth or a family to. So you can call them or text them to access those resources. You don't have to be in crisis. You could just have a concern. I know that parents have called just with general, like, I'm seeing these warning signs. Is this like 911, or is this like connect tomorrow with the school counselor or primary care physician? And so you can always call and ask questions. You can call and ask resources. We want to provide a big amount of resources, but also tailor them to the individual. So that's a great place to get started.
Incredibly valuable resource. Incredible what you're doing. Thank you for your time, Amy Chavez. Here's some websites, some information up there for you. sdyouthservices.org. That's where you can find the Here Now program. At our website, cbs8.com/youmatter, you'll find many of our stories and resources. And of course, once again, remember that 988 Suicide and Crisis Lifeline. It is there. It is a powerful tool. Use it if you need it or have any questions.